Good afternoon, and thank you for joining One Group's informational update. My name is Allison Dunn. We are glad you could join us for our sixth update on the coronavirus and various business-related impacts. We know there's a lot of information out there, and we appreciate you spending your time with us. Last week, we started the discussion about planning for employees to return to work and provided specific guidance. This week, we will continue with that focus and provide other timely updates as well. We have several of our experts with us today. Many of them you've heard from in the past. We have Paul Kader, Vice President of Risk Management Services, Casey Cohen, our Senior Human Resources Consultant, Nate Bradley, Employee Benefits Consultant, Mike Tisdale, Vice President, Dennis Ask, Senior Account Executive, Cyber Risk Specialist, and also Todd Hoffman, our Senior Bank Liaison. We will be discussing updates to address our clients' frequently asked questions in various areas, such as risk management and claims, human resources, employee benefits, including retirement plans. We'll also be discussing matters relating to cyber and provide information on small business relief. We do have to include our disclaimer. It's for informational and educational use only, and nothing in this discussion should be considered legal advice. Please consult with the appropriate attorney or advisor before addressing any situation raised in this discussion. So as you know, state and local governments are continuing to create their own frameworks to gradually lift the stay-at-home orders with important differences in each locality. And in turn, employers are taking steps now to prepare to reopen their physical workspaces and to return their employees to work in offices and other facilities when it's appropriate to do so. So for today, we've structured this discussion to cover key updates in areas that our clients have been asking about. We also requested that participants share any discussions with us before today's webinar. So we'll be including responses to those in our discussion today. And then due to the numbers of participants on the call, we've muted all the callers. But if you do have any questions whatsoever after the discussion, please continue to reach out to your One Group contact. We will be posting information to the website, onegroup.com, and we do have a COVID-19 section on the main page that includes all of our webinars, recordings, any attachments or documents we reference are all posted there. So with that, we will turn the conversation to risk management and Paul Kader. Paul serves as One Group's risk management subject matter expert. He's also a key contributor to our internal return to work task force, and he works extensively with our clients as well. Paul?
Thanks, Allison. I appreciate it. So today we're going to talk a little bit more about our reentry procedures and reentry strategies, and then we're going to deal a little bit with OSHA record keeping and reporting. That's been a real hot ticket for a lot of our clients and a lot of questions. We've spent many hours dealing with those concepts, and then we'll touch briefly on workers' comp reporting also as it relates. The return to work process and the re-engagement process and the re-entry process, One Group is going through that on a day-to-day basis, just like everybody else. We have a task force that are dealing with certain things, and the material that we discussed last week, the outline for returning people to work, as well as the materials we put up on our website, they're still there, and I'm sort of delving a little bit deeper into a little piece of that right now. And it sort of relates to what we've been dealing with in the past week or so. So I guess I want to get into the weeds just a little bit with you on the front end of the return strategy. The first thing we talked about was building a strategy and building a team around that whole process, getting those key individuals involved in an overall 40,000-foot view of what is it we're going to try and do here, what's our objective, and things like that. We did that here at One Group. We had some of the executive management team and some of the department heads get together and talk about, well, what's this going to look like? We've moved most of our employees off-site. We're working from home very effectively now. So we have to look at this and say, what's our overall strategy as we move forward? So when you're getting into that concept, that strategy, think about today, think about tomorrow, think about May 15th when things start opening up, hopefully in New York State a bit, and think of the months ahead where they open up gradually and move forward and how you're going to deal with that. And then also think about where you're going to be a year from now. Hopefully there's a vaccine out. We've seen some good progress, albeit slow and small samples. with some of the drugs that are out there now. So hopefully things are changing, and a year from now we'll be in a much better position. But as you start planning your move back into your offices and factories and healthcare facilities now, then think about where it's going to be a year from now, because you should start planning that. We built a tactical team. We've got several of us that are working on an almost day-to-day basis, identifying what are the key things. We're going to look at moving back into our building and back into our operations and out of our homes on a phased-in basis. So we want to make sure that as we take those steps to move people back in, number one, the people are moving into a safe environment and they can feel confident that they're in a safe environment. But we also have to recognize that as we're moving in, this whole situation is going to be changing. So as we take it phase by phase by phase, we build our standards and our protocols for this given phase that deals with the current moment, recognizing that's going to change in a few days, a few weeks, or whatever. We have to be ready to pull back, or we have to be ready to take that next step of opening up our business as we move forward. We have to keep a constant eye out on everything from the scientific news to what the government's doing to what's happening in our communities and what's happening relating to the testing, so that we can adapt our changes and our phases as we move forward. In our activity, we've looked at things like how many people are we going to let back in the building during this first phase, where things are still pretty well tightened down. We're not sure of what the effectiveness of testing and any kind of therapeutics is going to be right now. We're looking at what's the effectiveness of the whole mask issue as we go across. There were people outside are supposed to be using them when we come in the office. Who's going to be using them? Or where are we going to free up people not to be using them and things like that? So all specific issues as far as how do we maintain that distancing and the protection so our employees feel safe as they come back. We're looking at the hygiene practices of walking in the door. Do we walk in the door and then immediately wash your hands and wash up before going to your workstation? Or how do you handle that whole process through the course of the day? A big discussion we've been having that you might be having too is what about the cafeteria and the vending machines and the refrigerators and the coffee machines especially? How do we make it through the day without constant access to coffee? How do we deal with those things? Because they're all touch points. And whenever you're looking at touch points, those are transmission potentials. So these are things that we're looking at as we build the rules for the office. We also look at outsiders coming in, whether it's, are we going to allow other customers to come in? Are we going to allow our carrier partners and things like that into our building? How about vendors? How about contractors? We need to allow people in to fix that leaky pipe when it's leaking. How are we going to do that? So these are all issues as you start getting into this, which you've probably already started the process. You have to look at, you have to build sort of a concrete plan going forward, recognizing the plan can change at any time due to change in the situation, but it's good to walk into it with a plan because you can use that plan to educate your employees to build their comfort and their confidence in coming back into the workplace. The bottom line with this is you want to make sure that your plan and your move back into the workplace is gradually and safe, and in order to keep that confidence of your employees. So if you want to look at this a little more, there's more information on our website. The whole outline is in there, and if you want to discuss it, feel free to give us a call at any time. We'd be happy to discuss that with you. We'd be happy to get into conversation with you because we're learning as we go on this also. So I want to shift gears a little bit and move to OSHA reporting and OSHA record keeping, two different things. In regard to these two things, the reporting and record keeping, they all hinge on the OSHA record keeping requirements, which are found in 29 CFR 1904, if you're really into reading regulations. In regard to COVID-19, recording and reporting of injuries or illnesses, as you would in any OSHA case, is the same as it was before, with the addition that COVID-19 has been recognized as a potentially injurious workplace illness, much the same as some other respiratory disorders and things like that, but contrary to the common cold and flu, which are not recordable or reportable injuries or illnesses. So COVID-19 has been accepted. It is something that if somebody contracts COVID-19 and meets the other requirements for recordability or reporting, then you do have to take those steps. So let's go to first recordability. When I'm talking about recordability, I'm talking about what goes on your OSHA 300 log on a year-by-year basis and what's reported on the OSHA 300A summary come February 1st. An incident is recordable, and COVID-19 incidents are recordable if they have first of all, a diagnosis of COVID-19, and that's based on CDC guidelines. And what the CDC says is if you have one respiratory sample that produces a positive COVID-19 response, then it is a positive test. So in that regard, if somebody goes out with symptoms, never has a test, or comes back before they have a test, that is not a recordable injury because you do not have that first step, which is a positive diagnosis of COVID-19. This is one of the gray areas that we're starting to run into, because what we find out is that people go out with COVID-19 symptoms, or they go out maybe on a quarantine situation, and you don't find out about that positive test. Or they return to work without the positive test, but now we've got antibody testing that goes backwards and says, yes, that person did have COVID-19 and this is a positive test. So you have to keep your eye open on these things as far as what it is we're recording. But the bottom line on this point is that OSHA does not consider it a recordable injury or a recordable illness unless there is a positive COVID-19 test. So the next thing you got to check, so you have somebody that goes out and they get a positive COVID-19 test. The next step is probably the one that I've spent the most time on the past 3 weeks, is whether or not that response is work-related. So, and here OSHA is sort of giving you two directions to go. For healthcare, emergency care, and industries like that, where there's a high prevalence of exposure, their assumption is it's probably work-related, but you can defend that by finding out whether or not there were other sources of potential exposure that employee could have been exposed to. What the bottom line is, it's up to you to find out whether or not that healthcare, emergency care worker has been exposed to a COVID-19 positive person in the course of their work duties, and whether or not that constitutes enough evidence to say it's work-related. But assume it probably is in those industries. OSHA came out and said in other industries, manufacturing, office work, things like that, where COVID-19 is not as high a prevalence in the workplace, then they're going to assume that it's not work-related unless there's evidence to support that it is. So if you had a small group of employees that turned up to be positive in your workplace and this employee was a member of that group, then it could be assumed that they are positive, he is therefore positive from that group. Unless there's other evidence to say, nope, he wasn't in on those days where we found out that they were positive or shortly before, but his wife is positive, so we think he got it there. Anytime you're doing this work-relatedness investigation, make sure you document your results and keep that on file for whichever direction you're going to go. If you're going to report or record it as a workplace injury, you want to make sure you have the documentation, and maybe even more importantly, if you're not, you want to make sure you have the documentation and your rationale for not reporting it, because you could be called to defend that someday. So we've got the positive diagnosis of COVID-19, we've got the work-relatedness identification, and the other thing is the recordability issue, which takes into account the degree of injury or illness. And here we look at whether or not the treatment for that individual went beyond normal first aid. So did they go home and just take over-the-counter ibuprofen and try and weather the storm, and they came back to work afterwards? Even though they were COVID positive at that point, if they didn't meet the requirement of treatment beyond first aid, it's not recorded. Or did they lose time? So here we get into the situation of did they take, and in lost time for OSHA, it differs from lost time for workers' comp. Lost time for OSHA deals with, were they physically able to work in the time, and were they written out of work by a physician? So if they were written out of work, if they could not come to work because of the sickness, then they're losing time. So if in that case, if they're COVID positive, if you consider it work-related, and they've lost time from the job, then it is recordable on that 300 log. If it's COVID positive, work-related, but they haven't lost time and they haven't had any treatment beyond first aid, then it's not necessarily recordable. You still have to watch it in case it converts over, or in case they lose more time or whatever the case is. But you have to meet all of those criteria in order for it to be recordable on the 300 log. So now let's kick over to the more serious cases. And unfortunately, we've been dealing with these on a day-to-day basis. Fatalities and hospitalizations. And when you get to fatalities and hospitalizations, there's key things you got to remember. If you have a fatality, whether it's another injury in the workplace or whether it's a COVID-19 related case, you have to report that incident to OSHA via the OSHA hotline, which is an 800 number, or online within 8 hours of your notification of the fatality. And that's an important piece to remember. It's based on your notification. The individual, we've had several cases where individuals have passed, the employer doesn't find out for a week afterwards. Well, the clock doesn't start ticking on your report to OSHA until you find out about it. And in hospitalizations, those situations, they have to be admitted to the hospital. It's not an emergency room visit for observation. If they are admitted to the hospital, then you have to report to OSHA via the online system or via the 800 number within 24 hours of your notification of that hospitalization. So as we look at that, we say, okay, so let's say we had one of our employees that went to the hospital, they were admitted. We still have to make sure that they meet the criteria of COVID positive. And sometimes that can be very difficult to track down, specifically in hospital situations. But you have to make good faith effort in trying to find that out. So you find out that it is COVID positive, they were admitted to the hospital, you're thinking, I have 24 hours to report that. You still have to identify whether or not it was work-related. And you have to support your decision whether it was or whether it wasn't with evidence. So if you decide not to report to OSHA because you have evidence that it's not work-related, you can hold on to that, make sure you keep your evidence. If you find out that it is probably or definitely work-related, you report it to OSHA. Now, what I want to make sure you understand is that work-relatedness, when it comes to these reportings to OSHA, the telephone call or the online report, that can be really tough, but you have to work hard in a very short period of time to make the determination and make the decision on whether or not you're going to report. The clock starts ticking as soon as you get notified of the incident as far as the hospitalization or the fatality. So you have to get to work and make your decision whether you're going to report, whether you're not going to report, and what information, what evidence you have to support your decision. One caveat to all that is that you have to remember that reporting is not an admission of any violation to OSHA. And the chances are, particularly with COVID, that you haven't violated anything. Whether you're in healthcare and you have a good sound infection control program and good sound use of PPE and things like that, whether you're in industry and you just have good sound work practices to avoid situations like this, you may have put in additional hygiene practices and work scheduling practices to avoid COVID. Just calling it in and reporting that you've had a fatality or a hospital admission is not an admission that you've done something wrong. It will, in fact, spark an investigation by OSHA. Right now, particularly in the downstate areas, and I'm not quite sure of upstate, but in the downstate areas, OSHA has a guidance document out that their compliance officers are not going into the field to do these investigations because of the degree of spread of the virus. They don't want their people getting sick either. So they're doing these things by telephone, by mail. They'll send out a questionnaire, and they're rather lengthy. They're 36, 38 questions long, asking for a whole host of different data points that you have to provide back to them. But in that process, if you're providing back information that, yes, we did this, this, and this, we have these programs in place, we didn't have any other people that were sick, et cetera, you're not admitting any guilt in that. So you're not admitting any violation. And I see a lot of investigations that come up with no citations afterwards. They recognize the volatility of this whole situation. So I do recommend, and discussions with area directors across the state with OSHA, I do recommend that you err on the side of reporting if there's evidence to say it is work-related or a lack of evidence to say it's not. And you hear or you see that you have a prevalence of COVID-19 in your workplace. So if you want to talk about that, if you have situations, please feel free to get in touch with us, and we can discuss that with you also. I want to just real briefly touch on workers' comp reporting, just because Kelly Goodsell isn't here today. We've been dealing with this, and OSHA and the workers' comp situation sort of go hand in hand, because workers' comp is also based on work-relatedness. So if you have that COVID illness, the medical costs, lost time associated with it, then you want to do your investigation to find out whether or not there's work-relatedness in that too. And again, in this case, you've got a little more leeway. If you suspect that it is work-related, or if the employee asks you and says, hey, I got this at the workplace, I would report it as a workers' comp claim, send it into your carrier. Report it to your carrier with all of the information that you develop. The carrier's claim adjusters will do the investigation. They do a relatively deep investigation on these. And COVID has been named as a disease that is compensable in New York State if supported with the proper information of work-relatedness. So it's not a given, as in some other states that have followed the track, but in New York State, it's based on the investigation. So when we go through all that, we say, bottom line is you go through that and find out whether or not it is a work-related situation, whether there is lost time, and you can talk to your broker, you can talk to us, you can talk to your adjuster about those situations where maybe you paid that individual while they were out on their quarantine, and they were also positive and things like that, to see how the workers' compensation system will respond to that as far as what has to be paid and what doesn't. So now if we go back, we've talked about notifications. OSHA reporting for the employer, what happens is we've seen OSHA get calls from the employer, as we've talked about here. We've seen OSHA get calls directly from an employee or an employee's family member telling them that, hey, they were hospitalized or they passed away. We've also seen reports going to OSHA through the New York State DOL, which got it from an employee's friend, who the DOL then called OSHA, and OSHA then called the employer to get things going. So if you have an incident, you know about it, chances are OSHA is going to find out about it if there's hospitalization or fatality anyway. So the best bet is to get your investigation started right off the get-go, so either you report or you can respond to them if they call you. From a workers' comp standpoint, we've seen reports naturally going from the employer to their carrier. We've seen reports going to the New York State Compensation Board from the employee or the family, and then the Compensation Board notifies the carrier, and the carrier notifies the employer. Or we see reports going directly to the carrier if the employee or the family happen to know who the carrier is. So again, there's various ways for these reports to reach those bodies, whether it's OSHA or your workers' comp carrier. When you're doing your job from a management standpoint, take a look at what's going on, and if you get notification of an incident, do your investigation, decide what you're going to do, and then do it. We can assist in all these areas, whether it's the return strategy, whether it is the OSHA reporting, whether it's the workers' comp reporting or other insurance reporting. Please feel free to get in touch with any of the folks on this call or anybody you see on our website. We'd be happy to chat with you about it and talk to you. We're dealing with these things every day with multiple clients. I'm in touch with area OSHA offices at least daily, talking with the folks that are out there enforcing the regs. So please feel free to give us a call at any time on any of that material. I thank you for your time, and I want to turn this back over to Allison so we can move on.
Excellent. Paul, thank you so much for all of the updates and information. Very helpful, very accurate information. So thank you. We're now going to turn to Casey Cohen. Casey has been very busy advising our clients related to all the new legislation and questions coming up as a result, as well as best practices. So Casey will be continuing the discussion about planning for the return to work, as well as providing other updates. Casey.
Thanks so much, Allison. Hi, everyone. Thanks for joining us. I want to spend a little bit of time talking about a question that we receive very often, and it goes along with returning to work, and as employees or employers are looking to call back employees and those that might have been out either out on layoff or on furlough or not working over the last several weeks, and now employers are looking to have them return. The common question that we're receiving is, what if an employee is fearful to come into the workplace? What can we do? What are our options? So of course the answer depends on the specifics for each situation. There's not a clear-cut answer, but there's certainly a variety of factors to consider in these types of situations. It certainly should be case by case. But some of those factors that need to be considered include, what are the employer's policies? So what are, do paid time off policies apply? If so, what does the policy say of how to handle someone who might not request to use their vacation time but doesn't come to work? Are they automatically deducted a paid time off day or not? Also, could it be an FMLA situation, family medical leave, or another type of leave of absence? What are the employer's attendance policies? And in certain cases, what are the disciplinary policies? Because in some cases, an employer can follow their disciplinary policy for someone that refuses to work. Again, we're looking at all these different factors. There's certainly regulations that could come into play. With OSHA, for example, with employees, they can refuse to come to work if they reasonably believe that they are in imminent danger. And they have to have a reasonable belief that there's a threat of danger or death or serious harm if they come into the workplace. So essentially an employee can refuse to come into work if they have a specific fear of contracting COVID-19 as opposed to just a generalized fear. Other regulations could be the National Labor Relations Act, the NLRA, and that applies to both unionized and non-unionized environments, and that's where employees have the right to join together to engage in a protected concerted activity. So what that means is if employees join together to refuse to come to work because of unsafe working conditions, that could be something that's protected from disciplinary action. Other regulations that could apply include the Americans with Disabilities Act, so the ADA, and that's where if someone has, certain underlying medical condition that might put them at greater risk for COVID, or a different or something that qualifies as a disability, an employer would have to look to make a reasonable accommodation for that. And then, as we're familiar with the Families First Coronavirus Response Act, the FFCRA, which provides certain protections to employers who are unable to come into work due to COVID-19 related matters. So those are just some of the regulations that could apply if someone has a fear of coming into work. And as we know, the CDC recommends flexibility, so they are advising employees to ensure their sick leave policies are flexible and that they're consistent with public health guidance, and to make sure that employees are aware of such policies. Also, it's recommended for employers to explore all available options for employees so that they do reduce their risk to the virus. So things we've been talking about, such as, continuing to work from home, splitting shifts, reducing hours, making those schedule changes to avoid employees from working in close proximity with each other. So that's a lot. And where do we start with all that? So generally what's recommended when you do have someone that is fearful to come into the workplace, what do? We start with a conversation. And a lot of times within that conversation, we could better understand the employee situation, but also gives the employer the opportunity to share some of the measures that they've already put in place to reduce the risk. Some things that as we've been talking about include temperature checks or rearranging workstations to ensure, 6 feet distance, requiring masks of either employees, visitors, both, those types of measures. So really to start with that conversation to help put that, help the employees feel more comfortable with returning to the workplace. And then, once they're back, along the lines of what we've been talking about, but that frequent ongoing communication is important to ensure that employees know that the employer is putting measures in place to ensure a safe working environment. So again, with that question, there's a lot to consider, but generally you want to look at your policies, you want to look at any regulations that come into play, and start with that conversation with the individual to determine what appropriate next steps might be. On the same kind of note of returning to work, we're getting a lot of questions relating to unemployment insurance. As we know, the CARES Act provided additional benefits to those that are facing unemployment because of COVID-19. Those additional benefits can include the additional 13 weeks, the added categories to be considered qualified or eligible for unemployment, and then the additional $600 per week for those that are receiving the benefits. I think there was even a Syracuse.com article this morning that I saw kind of on the same topic that, employers are starting to be concerned that someone may not want to come back as they're looking to reopen due to the enhanced unemployment benefits. So with that, it is important to remember that the individual state always makes the decision on unemployment eligibility. They make it on a case-by-case basis specific to each claimant situation. According to the New York State Department of Labor, the DOL does suggest that if you're going to reemploy someone, that you contact them directly. And then if that person refuses to report to work or refuses the rehire, you can notify the Department of Labor directly in writing. So this is specific to New York, but really each state does have their own process to contest something, or at least to notify them should someone refuse work. You can also notify the Department of Labor specific to your state, but directly to communicate the beginning of a recall. So as a reminder, the state does make the ultimate decision on unemployment eligibility, and it is on a case-by-case basis. So an employer should never indicate to someone if they will or will not be eligible for the benefits, but again, refer them to the state, and the state ultimately makes that determination. New York State has provided some FAQs on this topic as well. One of the ones that they have published provides a little bit of insight to the process, but the question pertains to being someone that's immunocompromised. The question refers to, this individual works near a lot of people and they're personally uncomfortable going into work due to their concerns about their health. Am I eligible for unemployment? The answer that New York State provided is, generally speaking, this person would not be eligible for unemployment insurance if they voluntarily leave their job. It offers guidance that before leaving work, to speak with your employer, look for alternatives. Is there sick time available? Is there leave available? Is there reasonable accommodation available? And then the FAQ further talks about to obtain medical documentation that identifies those work restrictions. So there's a little bit of insight provided by New York State as to the eligibility process there. The Department of Labor, the Federal Department of Labor, also has some FAQs on the topic as well, and again, provide some more insight. One of the questions is, my employer has remained open because it is essential. I'm not sick, nor is anyone in my household. I do not have children or care for someone who cannot care for themselves. However, I am afraid of getting COVID-19 from customers. So I quit and filed for unemployment. Can I obtain benefits under the CARES Act? The response in this FAQ was no. This reason does not fall under the list of eligible criteria to obtain benefits. So as a general matter, someone is likely to be eligible for the extended or enhanced unemployment due to concerns about exposure to COVID-19 only if they've been advised by a healthcare provider to self-quarantine as a result of those concerns. That's a general statement, and again, provided by the Department of Labor, but hopefully provides some sort of insight as to their eligibility process. And again, each state does make their determination as well. So even with that information, again, the decision is ultimately up to each state. Another question that's posed is, I was furloughed by my employer, but they have now reopened and asked me to return. Can I remain on unemployment? And again, the answer to this is generally no, unless the individual could identify another qualified reason in the CARES Act for remaining out of work. Generally, by saying, no, I want to stay on unemployment, that is not a qualified reason for unemployment. And then another question, would my workers quit because they said they would prefer to receive unemployment under the CARES Act? Are they eligible for that? If not, what can I do? And again, the answer is generally no. The employee is not eligible unless it's due to a true COVID-19 reason. And if desired, employers can contest the unemployment through their specific state's process. And as I mentioned, New York has one as well. You can contact the Department of Labor directly, but each state certainly has their own process available to contest unemployment if needed. I also want to talk about, again, as we're thinking about returning to work and planning and putting that process in place as we gear up towards having employees return to work, some of the planning considerations. So with the recall policy, if you are in a situation where employees have been placed on layoff status or furloughed, when it comes to recall, it's recommended to ensure you have a fair, non-discriminatory policy or procedure in place in order to begin those recalls. So what that means is that there should be a documented policy or process in place that really outlines the decisions to recall the employees, and it should be based on business-related reasons and non-discriminatory criteria, so such as length of service. You know, how are we going to recall our employees? Where do we start? A lot of us are talking about that phased-in approach, which not everyone comes back day one. So where do we start? So it's really important to have a policy or procedure in place that outlines your criteria for choosing, you know, who's going to return when. Have that documented and ensure that it's followed consistently, just to ensure you have a fair process and you're ready to go when you are ready to call employees back. Another important thing to remember is, you know, every HR person's favorite thing, paperwork, right? We love paperwork, but the new hire paperwork is important to remember when you are bringing employees back. So typically, if you have a furloughed employee, they remained on the payroll, they weren't terminated, they're still considered an active employee, they just weren't on the schedule. Generally, they would not need to complete all the new hire paperwork. However, if you have those that were placed on layoff status, they were terminated from the company, they're coming back, they're going to be treated as a new hire, they're considered a new hire because they were actually terminated from employment, they would generally need to complete most, if not all, new hire paperwork because they are, again, a new employee essentially coming back to employment. So as a reminder, in New York State, a wage acknowledgement notice is required upon hire. So if the employee was placed on layoff and therefore terminated, they would need to complete that new or the wage acknowledgement form required by New York State. And also certainly if there was any changes in the pay, frequency, amount, maybe someone's status changed, a notice would also be required at that time. And another point or something to remember as we're bringing employees back is to think about communicating their time off accruals. So, some might have used all of their time off, some might have received a payout, some might have stopped accruing during this period. So I think it's best practice and a good reminder to the employees so that they are well aware of what time off they have as they return. So with that concludes my updates, and I will turn it back to Allison.
Okay, thank you. Lots of information. And I just want to mention again that everything we're talking about is posted to our website. I just want to stress that because we often hear, wow, you guys covered a lot, and we know we do, but we want to make sure it's all available to you on the website. With that, we're going to turn things over to Nate Bradley now. Nate has been looking at different benefits matters, looking at compliance, making sure our consultants internally are all well equipped with those so we can share them with our clients. And he's been working closely with clients as well on those. So with that, we will turn things over to Nate.
Thanks, Allison. Thank you, everyone, for joining us this afternoon. I'm going to use my time to just cover a few of the questions that we've been receiving. First one's a quick one. Related to antibody testing, and if that will be covered in full, similar to how testing to diagnose COVID-19 is covered in full on all plans. And the answer is a simple yes, that coverage is mandated for all plans when it's ordered by a physician and provided by an FDA-approved lab. So we're seeing some provider offices. I saw a dermatology office this morning that is basically saying anyone that wants to come in for a test, come in for an antibody test. if it's ordered by the physicians there and provided by the FDA-approved lab, that will all be covered in full. So that's a quick and easy one. The next question, not so much. We're getting a lot of questions about how COVID-19 and claims associated with that are going to impact groups. So the self-insured groups want to know how it's going to impact their weekly, monthly claims, and the fully insured groups want to know how it's going to impact their renewals. So we're seeing a lot of different things out there, reading a lot of different articles from different resources that we tap into. Where some analysts are thinking that self-insured groups are going to see increased costs by as much as up to 7% this year, depending on how far the virus spreads and how deadly the outbreak proves to be. The estimate is dependent on a significant amount of the group's population becoming infected. So this is really going to be group by group and region by region. On the low end, this article from Willis Towers Watson was estimating that if 10% of your population become infected and have low morbidity, then it would have a less than 1% impact on your plan costs or your claims that you're paying out. This is generally geared towards self-insured groups who are paying the claims as they're incurred. But however, if the virus was to infect 50% of your population with high morbidity, then the cost could be up to almost 7%, the study found. So that is on top of what they would assume as a regular 6% kind of year-over-year increase. Depending on what part of the country you're in, those numbers may be off the charts. I'm not sure how many central New York groups are seeing 10%, let alone 50% of their population become infected. But there's groups downstate that it might be running through the whole organization, and it's a completely different story. The size of the premium increases is likely going to depend on the effectiveness of policies to mitigate the spread of the virus, the potential for a new wave of infections. So if once everyone starts opening up and getting back to work, we end up right in the same spot, in a few months. And then down the road, the cost of a vaccine or different therapeutic agents. I'm going to throw a few numbers at you. And again, this is all going to be posted to the website, so you don't need to, write it down, even if you care to write it down. But some of the numbers that we're seeing related to costs, the test to diagnose COVID-19, somewhere between $50 and $100. Administration of the tests, $100 if performed in your provider's office, or up to $1,000 if it's performed in an ER setting. And these costs will vary tremendously by region. So our downstate groups versus our central New York groups versus someone maybe, in the North Country or Pennsylvania, you're going to have a wide range of costs. And then admission and treatment in a hospital setting, they're saying up to $10,000 per day with an average stay of 10 days. Again, all depends on the region. And then also depends on the patient and the severity. Those with asthma or other respiratory issues or chronic conditions such as diabetes are more likely to need more intense and expensive care. Now, estimates for an actual case of COVID-19, again, there's many cases that people are asymptomatic, never seek care, or just have a mild case and a very mild case and maybe never even leave the home. So they're saying $250 for a mild case. That would be someone that, probably goes to their provider's office, gets a test. $2,500 for a moderate case, $30,000 for a severe case that requires hospital admission, and up to $100,000, possibly more, should an employee develop a catastrophic case and require a stay in an intensive care unit. So those are very high numbers. You look at a $100,000 claim number, but if you kind of look at it with just regular high dollar claimants that might be running through your plan, if you only have one or two, there really may not be much of an impact at all compared to, the regular plan utilization that you see year over year. So that all is really more geared towards self-insured groups when you're talking about paying those claims out through the rest of the year. Now, our fully insured groups will not see any impact until their late 2020 or 2021 renewals, as you're just going to keep paying the rates that you're paying for the entire year. Those prospectively rated groups, or those with over 100 enrolled, will be partially rated based on how COVID-19 impacts their actual population. whereas those in the under 100 market will be more impacted by how it hits your region and the block that you're rated in. Now that's what we're seeing where some analysts and actuaries are thinking that costs are going to increase. I'm seeing more and more, and actually personally, and don't take that with a grain of salt, and more in the camp that costs may decrease as a result of this. Actuaries and analysts from Gallagher and Milliman are both predicting a decline in costs to the tune of up to maybe $600 billion nationally. And the reason is that unnecessary surgeries and procedures are being tabled for the foreseeable future. And they also believe that the government is likely to pick up many, if not most, of the COVID-19 related expenses. Hospital stays, and particularly intensive care stays, can rack up massive bills for individuals, but that really, they're saying, pales in comparison to the savings from the millions of Americans delaying care. Those savings also outpace the cost to insureds of waiving COVID-19 copays, deductibles, and tests, which most all insurers have agreed to waive to the participant. Most of the country has been under stay-at-home orders, and many non-emergency care visits and elective procedures have been canceled to help hospitals manage the surge of COVID-19 patients. And HCA Healthcare, which is the largest U.S. for-profit hospital operator, said that it's seen a 70% drop in outpatient surgeries so far in April compared with a year ago, and inpatient admissions are down 30%. So we've seen a lot of news about the hospitals being overrun in certain areas, but I think we're also seeing articles, and we're definitely seeing them here in central New York, of the hundreds of thousands of dollars per day that the hospitals are actually losing in revenue because they're not really doing anything else other than treating these patients. So ultimately, the magnitude of cost reductions will depend on how long care is deferred, and then if there's a second wave of infections, that would offset some of the estimates. But regardless, it is expected that costs will actually, healthcare expenditures will actually be reduced in 2020. And then I thought this was interesting, but actuarial analysis by Gallagher for similar crises, and I don't know that there's ever been a similar crisis, but they're relating it to kind of natural disasters where there's a lack of healthcare facilities or providers, and that's resulted in a short-term claims reduction for scheduled and non-urgent care. But surprisingly, in these instances, the analysis has consistently shown that close to 50% of those variable claims never show back up in the healthcare system, and there's definitely not a dollar for dollar for the pent-up need for care that'll emerge once we're back into, we'll call it business as usual. So, think those appointments that you may have had scheduled in the last month and a half that you have canceled and you're not going to get back on the books until next year or many months out. We'll probably see this a lot more maybe in the dental arena where you're not going to get your 2 appointments spaced out over 6 months this year, so that appointment will never get made up. And then the last significant component of the cost projections will be the overall infection rate of the population. So the infection rate of an employer's workforce will matter particularly to your situation, the severity of the cases, and then the subsequent hospitalization of those employees. Many models may be too heavily weighted at 30 to 50% of the population becoming infected, and this article that was citing Gallagher's model reflects more likely estimate of total infections that would be in the 4 to 7% of the population range. So again, that's a lot of speculation from a lot of different resources. We really don't know how it's going to play out if this continues to drag out for many months, or if things just open up and the elective procedures start again and the claims start flowing back through your plan. Then a couple of additional reminders to wrap up here. Telemedicine has been expanded, so that is covered in full for many, many plans. And we're also seeing close to half of all physicians, 48%, are treating patients through telemedicine. This is up from 18% just a year or so ago. So this can help you avoid going to your provider's office. Many carriers and groups are now offering this, again, at no cost. And I think a lot of providers have jumped in and are also reaching out to their patients about this. I can tell you earlier this week, my mother-in-law does telemedicine business, and she's about the last person I would have ever expected to get on board. But it's either that or miss your appointments at this time. And then on the ancillary benefit front, think your life insurance, long, short-term disability, things like that, even dental and vision. Carriers are getting, and in many cases, granted special requests from clients looking for exceptions to keep their furloughed employees covered longer. It really does help if you have a specific end date in mind, and then you can work with the carrier. And many of them have been very willing to work, extending eligibility, allowing people to remain covered, things like that. So as we hear of things, we will continue to push them out to everyone, and please do not hesitate to reach out to us with any questions, as I know most of you do not, but that's what we're here for. We're here to help, and that is everything I have for today, Allison.
All right, Nate, thank you so much. Great information. I'm just keeping a look at the clock here. We have 10 minutes left. We have a few presenters to go. We're going to get through things pretty quickly because we have a lot more to cover. We just wanted to pack in as much information as we could for today. So now we're going to turn things to Mike Tisdale. He's going to give us some more benefits information specifically relating to the retirement world. Mike?
Thank you, Allison. Good afternoon, everybody. I will be pretty quick here. So the last time I spoke on the call, it was about 3 weeks ago, and we were focusing on the CARES Act provisions, both the distributions and the loans for retirement plans. Our firm, we've been tracking the data as it becomes available to us. So I just wanted to share some of those numbers with all of you today. The data that we have seen thus far indicates that about half of large and mid-sized retirement plans have adopted at least one of the CARES Act provisions, whether that be loans or distributions. And a very positive sign thus far is that participant usage of either a loan or distribution is pretty low in plans that added the provisions. The percentages are really under 1%. So obviously the provisions have only been available for a few weeks now, but the low usage numbers thus far certainly brings about an optimistic tone, especially if the economy is steering closer to reopening and some sense of normalcy is around the corner. It's no surprise that the average 401k, 403b balance has lost ground in Q1 2020. But not only did most 401k savers not reduce contributions, according to Fidelity, roughly 15% of folks actually increased their contributions. So that's great news to see. Additionally, the average employer contribution was steady at 4.7%, which was a slight increase from 4.6% in Q4 of 2019. And right on par with Q1 of 2019, which was 4.7% as well. With regard to investment allocation, the data from Fidelity also highlights that only about 7% of folks made changes to their allocation in Q1. Though that was an increase from Q4 2019, which was about 5%, most of those folks only made one change in the quarter. So again, the numbers are very similar coming out of another record keeper, T. Rowe Price. They're the record keeping platform for roughly 5,700 retirement plans, and they cover about 2 million plan participants. Of those folks, roughly 97% have stayed the course and have not changed their investment allocation, and less than 2% of employers are suspending or reducing the employer match. So again, those are all great numbers, and they're very optimistic and really highlight the importance of timely, consistent, and repeatable education and guidance for your employees, for the plan participants. It's worked in the past, it's working now. The data reflects this. Employees are staying the course. Participant education content such as webinars, podcasts, digital hub materials, they're being consumed on an average 300% more than prior benchmarks. So these trends in communications will undoubtedly become more prevalent in the future. Our firm continues to evaluate how we can, further support participants during this time, through our current education resources, but also to enhance our offerings as we prepare to get back to the office. We've always hosted Zoom meetings with plan participants who are out of state and we anticipate Zoom meetings becoming more popular for local folks in the future as well. Although I definitely have a face for radio, recorded video content and communications to plan participants has increased and played a really pivotal role in sending out timely updates to folks over the last couple of weeks. So we anticipate that occurring as well as we get back to the office. And lastly, our biweekly live market update calls over the past couple of months have had a very positive turnout. And we anticipate continuing these on a routine basis as well. That being said, our next call is next Thursday, May 7th at 10:30. The presenter is Fidelity. And again, these are open for all plan sponsors, all plan participants to join. So if you'd like to join or you think your employees would benefit from the discussion, just shoot us over an email, support@onegroupra.com, and we can pass on the WebEx information to you. I hope everybody has a great day. Thanks.
Thank you, Mike. Great information. We're now going to turn things over to Dennis Ast, our cyber expert. Dennis?
Thanks, Allison. Hello, everybody. Hope everyone's doing well today. Just a couple of quick updates because I know we're short on time. So last week I talked a little bit about, the uptick in cyber and, roughly complaints are up about 300% over the past month. And what does that really mean? So the FBI gets complaints on a daily basis. So normally they get about 1,000 complaints a day. That has increased to, on average, about 3,600. So it's ranging from 3,000 to 4,000 daily. So a significant increase. I read a study from Google that shows that roughly at least a dozen basically government-backed cyber groups are really doing an awful lot of hacking that's out there, mostly phishing and malware. So they're seeing a tremendous amount coming from, government-sponsored activities. They themselves, when they're looking at, their email and the filters that they have on it from a see about 240 million spam emails daily. They're seeing it about an additional 18 million just from the coronavirus. So we continue to see it. Unfortunately, the criminals have kind of moved away from, setting up fake domains to really now looking at penetrating hospitals and medical research facilities. And what they're actually looking for is any information about a cure or a vaccine or anything else that they can be able to sell on the black market and make money for it. So, so we're continuing to see an increase. I just want to spend just a few minutes talking about then, good cyber hygiene. So, what do you need to do? It really starts with employee training. Get the employees to think before they click. Tell them don't panic. Just take your time with emails. If it doesn't feel right, doesn't look right, don't open it. If you do have an IT department that you could forward the email to be researched, please go ahead and do that. If you can, follow multi-factor authentication. Use a VPN to be able to protect yourself. Use strong passwords or passphrases as often as you can. Don't use public Wi-Fi. I know a lot of people say, well, but I'm on a VPN. I completely get that, but there's still an exposure just from using public Wi-Fi, so certainly avoid that if you can at all possible. Should secure mobile devices. There's lots of good applications and software that you can put on the mobile devices to protect them in case they get lost or stolen, as well as to help protecting them from a cyber event. Certainly be installing and updating anti-malware, specifically looking at next-gen and AI with those, because the cyber criminals continue to get more sophisticated. So you need to continue to upgrade your anti-malware. Stay current with your patching and your updates. This is where a lot of vulnerabilities happen, is because there is a issue with one of the applications that the cyber criminals know about. And if you don't patch it, they're going to continue to be able to attack. So most of those pushes you get on your phone about needs an update, or on your Surface or iPad or any other device, it's mostly to take care of a security issue that's out there. So stay current with those. Know what you have, right? Do a risk assessment. How many laptops do you have? How many desktops do you have? Know what's out there in the universe for your company. NIST, NIST has a great help you understand what you have out there. Also, have a backup, but more important than just having a backup, test it. Make sure it actually works. Monitor it to make sure it's not getting infected. At all possible air gaps, don't have it connected to anything so that it can't get infected. Certainly have great vendor management out there. Look at the contracts, make sure that they're beneficial to you, that vendor is going to hold and indemnify you from a cyber event, not that you're going to do it to them. So you want to make sure that you're protected in those. And the biggest thing I can say is have a cyber response plan. Know what you're going to do first. Do you have a cyber insurance plan? Do you know who to call? Do they have a breach coach available? If not, who's that first phone call going to be? Knowing that is going to save you a tremendous amount of time, effort, and cost if you do have a cyber event. So that's a really quick update. So have a great day, everyone.
Thank you so much. Now we'll turn things over to Hoffman.
Hey, I'm going to talk very quickly. So you guys. CARES Act. For $484 billion. Last Friday, 310 was approved for the PPP program, and that money is going to be for banks, those who have already submitted them or approved, but already placed. My guess is that first 2 weeks, the last time that one will probably be submitted in a couple of days. The big change that's coming right now is the first wave of loan closings are taking place. There's a lot of questions starting to come up as to how to calculate the loan forgiveness portion of the borrowed funds. And as has been the case with many aspects of these programs and these days, the answer to those questions are kind of unclear. Even more so, the application. SBA was supposed to issue some additional guidelines before the end. I've seen those that they've been issued. So I think all the banks are waiting for those to come out. I'm going to touch on a few items that are unclear, try to give you some guidance, but just want to remind you that clarification still needs to be made on these questions, the guidance from the SBA. So make sure you talk to your CPA and talk to your bank before you do anything or before you get too far into it. So one question is, when does the 8-week measurement period begin? That 8-week period begins on the date the lender makes the first disbursement to the borrower. It's not the date on which you're notified of the loan. It is not when the loan is actually closed. Can everybody hear me okay, by the way? Just got a text that maybe there was some interference. I'm going to keep going. So again, on the date that the first disbursement gets made. So what costs are allowed to be included when determining debt forgiveness? This is kind of crucial. So list CARES Act, an employer can receive debt forgiveness PPP loan for eligible amounts equal to the cost incurred and the payments made in the covered period. So if you're to take that statement literally, that not only the payments must be made during the covered period, which is that 8 weeks. Hold on, I'm also got to be incurred during that same 8-week period. I'm thinking limits the amount of money you can spend. I'm thinking that like accrual accounting, they meant for that to be one or the other. So that's one of the clarifications we've got to look for. Under what costs are you eligible for debt forgiveness? What costs are eligible for debt forgiveness? One of the things that came up is mortgage interest. And most people, if you're like me, are thinking that a mortgage is a debt obligation that's secured by a parcel of real estate, typically. But the meaning is defined under the PPP program is anything, a loan that is secured by real property. So if you've got a vehicle loan or an equipment loan, they may also qualify for interest payments. So talk to your CPA about that because that could broaden how you use the money. Keep in mind when you're talking about mortgage interest, that does not include mortgage prepayments or principal payments. So you cannot prepay your mortgage or make any principal reductions. Also, remember that not more than 25% of the forgiven amount may be used for non-payroll cost. If it is, then you have to repay some or all of that loan proceeds that were used for that. You have to ensure or maintain your staff and payroll levels. if you show a decrease in full-time employee equivalents, FTEs, and or a decrease in salary reductions of greater than 25%, then again, you may be repaying part of the loan. And again, that's during the specific testing periods. And one comment on the testing periods, that's become a key question in this whole thing is, when exactly are those testing periods? I've looked at a couple different worksheets I've seen, but I'm not comfortable putting them out on our website as of yet because, like I said, the clarifications haven't been made by the SBA. If you want to Google SBA guidelines for PPP loan forgiveness, there's some great stuff out there. Again, check with your bank or your CPA. They're all developing worksheets at this point that you can use, but there are some worksheets out there that will get you started on the process and are very helpful rather than trying to figure it out yourself. Lastly, the CARES Act specifically states eligible recipients seeking loan forgiveness must submit an application to their lender. So whatever bank you made application to, you're going to have to apply for the forgiveness piece. They're going to be looking for documentation verifying the number of FTEs and corresponding payroll amounts. The documentation is going to include canceled checks, payment receipts, transcripts of accounts, verifying payments on mortgage obligations, utility payments. They're going to want to see all of that. So the key to this, to getting, to making this happen for you, getting loan forgiveness, is good record keeping and good bookkeeping. That's going to be critical to the process. Again, we recommend that you place your loan proceeds in a separate bank account and you carefully track all your expenditures over an 8-week period. Frankly, I would track them prior to that 8-week period in case some of those payments that you made ahead qualify, and also after the 8-week period. So just keep a very close eye on it. Your lender's likely going to require those documents in a digital format, so keep that in mind when you're getting prepared to put that together. After you've applied for the loan forgiveness, the bank has 60 days to respond. So you will have that period of time before you have up to that period of time before they get back to you. Sure, there's going to be a lot more to come on this, so keep an eye on the news. I'm sure we'll have another webinar. If you have any questions, feel free to reach out to me, call me, email me, and I'll be happy to help you out. Thanks, Allison.
Great, Todd. Thank you so much. And I'm a little bit over, so we apologize about that. Again, we had a lot to cover, but we definitely want to thank all of you for participating in our series. We will continue posting information to our website, and we are posting everything that we discussed today to our website. There are definitely some helpful tools, so please check that out. And as I think everyone mentioned, we encourage you to continue reaching out. We are here for you. We know that this is a very difficult time, and we certainly are here to help you and help your business prepare to return to work. So thank you, everyone. Have a great day.